Hi, dear learners. For this week's lesson, we are going to focus on the concept of community and environmental health. Health education, being a part of social science, regards biological, environmental, physical, psychological, and medical sciences for health promotion and prevention of diseases, disabilities, and early death through education of community members in order to change personal beliefs, practices, and behaviors to improve health and well-being. The World Health Organization, or WHO, defines a community as a group of individuals living within a specified geographical location who shares common interests, beliefs, culture, values, and norms. Environment, on the other hand, is everything that is external to a person. It includes the following factors: physical, biological, chemical, psychological, and social. A community belongs within a specific environment. Community health is defined as an art and sciences of maintaining, protecting, and improving the health of all members of the community through organized and sustained community efforts. Environmental health comprises those aspects of human health that are determined by physical, chemical, biological, social, and psychosocial factors in the surrounding environment. According to the World Health Organization, or WHO, a healthy community promotes social harmony, meets individuals' basic needs, has sustainable resources and environment, has diverse and innovative economy, has members communicate, interact, and share experiences, has a clean, safe, and protective environment. Has individuals who are actively involved in activities and programs, participates in discovering local solutions to issues and concerns, provide access to appropriate and reliable health services and facilities, knows and understands local public health issues and concerns, is active in the promotion and celebration of historical and cultural practices and traditions. Communities can be healthy, unhealthy, or developing to achieve a healthy state. The factors mentioned can either positively or negatively affect communities. Unhealthy communities may arise from various elements like ineffective leadership, uncommitted community officials and members, poverty, poor education and training, unclean surroundings, natural calamities, war, and conflict, among others. Every community faces various environmental issues. Environmental issues do not only affect the nature itself, but also has a negative impact on the health of the people and other living things. Some of these issues are as follows: improper waste disposal. Disposal of waste without proper supervision often leads to environmental damage and also to the human body systems. The improper disposal of waste also causes injuries like cuts from broken bottles and rusted metal objects or falls from slippery constituents. Illegal mining. Illegal mining has a lot of negative effects. Initially, one may think that it is only the surface soil which is being destroyed, but there is more to it, like pollution of the bodies of water. Toxic waste is one of the most harmful effects of illegal mining. If the mining sites are near the bodies of water, the chemicals from the mining sites can also poison the water and the fish. Soil erosion. Soil erosion is a process that occurs naturally and affects all landforms. It can be a slow process that continues relatively unnoticed, or can occur at an alarming rate, causing serious loss of topsoil. Cyanide fishing. Cyanide fishing is one of the most destructive activities done by humans. This is a method of collecting live fish mainly for aquarium use, which involves spraying sodium cyanide mixture into the desired fish habitat in order to stun the fish. Pesticide drift. This refers to the unintentional diffusion of pesticides and the potential negative effects of pesticide application, including off-target contamination due to spray drift as well as runoff from plants or soil. These can lead to damage in human health, environmental contamination, and property damage. Deforestation. Deforestation is the process of forest destruction in order to make the land available for the other users such as farms and residential areas. Some of the most common methods of deforestation are burning trees and clear cutting. Oil spill. Oil spills are harmful to various species of animals, including marine mammals, birds, fish, shellfish. The majority of birds affected by oil spills die from complications without human intervention. Coral reef degradation. Coral reef destruction is defined as the degradation of the ocean's corals. It is normally caused by illegal fishing techniques, pollution, careless tourism, other natural phenomena such as earthquakes and hurricanes, and of course, climate change. Climate change. Climate change refers to global warming plus the large-scale shifts in weather patterns caused by the rising temperatures, driven by humans since the Industrial Revolution. And now, let's move to the prevention and management of environmental health issues. Environmental health encompasses all the external factors, physical, chemical, and biological, that may affect a person, including all the related factors that may have impacts on behaviors. It involves the assessment and control of those environmental factors that can potentially affect health. It is targeted towards preventing disease and creating health supportive environments. When assessing the environmental health of a person or community, external elements affecting the mental, emotional, and physical health of the person or the community are taken into consideration. The following are the foci when assessing environmental health. First, decreasing epidemics or childhood morbidity. Second, improving the overall preventive healthcare measures. Third, health regulations that cover housing, transportation, and water. Environmental health addresses all human health-related issues, which include control of diseases. Disease control is one of the major concerns of environmental health initiatives. The waste management system is built or upgraded to prevent water pollutants and the spread of diseases. Management of food diseases. Food management is another area covered by the environmental health. The regulation covers examining from how seeds are prepared and harvested, to the kind of fertilizers and pesticides used, all the way through the processing, packaging, and storage facilities of food products. It also ensures that all ingredients are safe for human consumption. Quality of water. Making sure that adequate drinking water or potable water is available to a community is another key issue with environmental health. Adequate irrigation for crops is also looked into to make sure that proper drainage systems are in place. The World Health Organization, or WHO, is committed to achieve the following in order to prevent and manage environmental health issues. Number one, implement environmental health standards in healthcare settings in low-income countries. Number two, lead the phasing of mercury-containing measuring devices in healthcare. Assist countries to implement Minamata Convention. Number three, support the development of healthcare waste national plans and implementations in the 72 GAVE, the Vaccine Alliance countries. Number four, work with actors in maternal and child health to implement the WHO and the United Nations International Children's Fund, or the UNICEF Integrated Global Action Plan. Number five, demonstrate the cost effectiveness of safe healthcare, waste management, and hygiene. Number six, publish environmental health standards and guidance in schools, ships, and aviation. Number seven, support ongoing implementation of guidance on water safety in buildings, environmental health standards in school, ships, and aviation, and within HIV treatment and care programs. Number eight, develop and implement recommendations on integrating water, sanitation, and hygiene with nutrition, including a particular focus on healthcare facilities in partnership with U.S. Agency for International Development and UNICEF. The prevention and management of environmental health issues also involve individual responsibilities, social consciousness, and environmental policies and laws. All of these factors contribute to the promotion of environmental health within the country. First, individual responsibilities. Some examples of the roles and responsibilities of individuals concerning environmental health include reuse and recycle waste products, conserve water, energy, and other natural resources, observe proper waste disposal, reduce the use of harmful chemicals, contaminants, and toxic materials, build compost to dispose plants and kitchen waste, avoid the use of plastic bags and bottles, styrofoam cups, and other non-biodegradable products. Walk or ride a bike when traveling at a close distance. Use eco-friendly products and participate in community projects, especially those which promote the protection and preservation of the environment. Social consciousness. Awareness of the different environmental issues equips the individuals in a society with sufficient knowledge and information on how to solve each one. This social consciousness builds cooperation and coordination among the members of a community towards the promotion of environmental health. It covers a wide range of areas and concerns such as sanitation, pollution control, food and drug safety, health education, disease surveillance and control, urban planning, occupational health, and environmental and public health research. Environmental policies and laws. Environmental law, or environmental and natural resources law, is a collective term describing the network of treaties, statutes, regulation, and common customary laws addressing the effects of human activities to the natural environment. Some examples of environmental policies and laws being observed in the Philippines are the following: RA 9729, which is the Climate Change Act of 2009, RA 9275, the Philippine Clean Water Act of 2004, RA 8749, Clean Air Act of 1999, RA 9512, Environmental Awareness and Education Act of 2008, RA 6969, Philippine Toxic Substances and Hazardous and Nuclear Waste Act, Presidential Decree 1586, Philippine Environmental Impact Statement System, and lastly, RA 9003, Philippine Ecological Solid Waste Management Act of 2000. That will be all. Thank you. Always remember, eat clean and exercise, stay healthy, and you are loved.